Hello and welcome. I'm Jon Garlick and I'm here with Sheriff Matthew Wade, and this is Calhoun County's Most Wanted. Hello, Sheriff.
It's always good to be on the show, John.
It's always good to have you here. You're stabilizing influence. Yes. And let's see what other stabilizing things you've done for the county. Let's take a look at the count this week.
We got 4 arrests this week, brings our count up to 4,842 people arrested, all because somebody was willing to help us. I know that at least one person on there somebody called me personally about, and we were getting tips on, and I appreciate that so much. We can't do it without you, so thank you.
Always getting the community to help you guys out, and you've been helping the community out lately. You've got a couple of new things in.
We do. We probably have about one overdose at least a week. Sometimes it's maybe a couple a day. It just depends, and that's pretty sad that we have that. And so ambulances in rural part of Calhoun County takes them a while to get there. A lot of times we're there first. So Alabama Department of Public Health was able to give us free Narcan.
Wow.
So deputies are going to have Narcan in their cars, and we've had it before, but some of the issues were that it would get hot and it would become ineffective. So this new stuff that we have is not supposed to be so temperature sensitive, and hopefully we don't need it, but if we do, maybe we can save somebody's life. Deputies already carry tourniquets, but and AEDs. So we're doing all that we can to make sure that we can save lives when we can. So.
Well, that's good. Having deputies equipped for those far reaches of the county where maybe they're the only ones there that can save a life, and they have.
And we have.
Lives,
we have. So.
Excellent. Well, we're going to be back in just a few minutes. So we got the first half of the lineup, so stay with us here on Calhoun County's Most Wanted.
Scammers are now taking advantage of people's increased economic anxiety. One of the latest ploys is to phone unsuspecting victims and pose as representatives of utility companies. A scammer may identify themselves as your local power company. They may be able to identify your account number and even your name and address, but that does not mean they are legitimate. They may claim you are past due and your services are about to be shut off. Do not let the implied seriousness of this call frighten you into making a quick decision to pay. Instead, hang up the phone, then contact your local utility company directly using the phone number listed on your bill or on their website. Speak with a representative to check on your account. Never give your banking information over the phone unless you have placed the call yourself to a phone number that you know is correct. Utility companies do not demand your banking information by email or phone. They will not force you to pay over the phone as your only option. Any reputable company will never request payment by gift card, reloadable cash card, wiring money, or cryptocurrency. Some of the requested cards could be MoneyPack, Vanilla, Google, eBay, Amazon, or even an iTunes card. But you should know that there are still many more variety of cards the scammer could suggest that you use. If they ask for payment in any form of these cards, it is a scam. For more information, you can go to ftc.gov or call me, Nancy Hilton, at the Calhoun County Sheriff's Office at 256-236-6600.
Welcome to the first half of our lineup here on Calhoun County's Most Wanted. First up on this half, Rogelio Prado Cajo. Mr. Prado Cajo, last known to be living in Leeds, is wanted for failure to appear in trafficking in methamphetamine. And this is Betty Story. Miss Story, last known to be living in Jacksonville. She's wanted on a probation violation for possession of a controlled substance. Take a look at Joseph Burton. Mr. Burton, last known to be living in Anniston. He's wanted for failure to appear on distribution of a controlled substance. This is Jeremy Goss. Mr. Goss, last known to be living in Alexandria, he's wanted for failure to appear on illegal possession of prescription drugs. We'd like you to take a look at Jeremiah Atkinson. Mr. Atkinson, last known to be living in Anniston, he's wanted for failure to appear on domestic violence third. Meet Everett Boyd. Mr. Boyd, last known to be living in Anniston, he's wanted on a writ of arrest for distribution of a controlled substance. This is Iris Ledbetter. Miss Ledbetter, last known to be living in Anniston. She's wanted on a writ of arrest for distribution of a controlled substance. And that's it for the first half of our lineup. Stay tuned for the second half later in the show. Welcome back. We hope you saw somebody in the lineup that you know or know where they are, and if you do, you can call the sheriff personally because he will arrange for them to be picked up. Now we're here with a really special guest from Bradford, Marbi McCann, territory manager for Bradford. How are you?
I'm good. I'm grateful to be here with y'all this morning. Thank you for having me.
Well, we're glad that you can join us. So why don't you tell our viewers a little bit of some basics about what Bradford does?
So Bradford, we are substance abuse treatment. We have 2 inpatient facilities in the state of Alabama. We also have a contract detox unit at Walker Baptist. I'm sorry, let me back up. The locations of the inpatient facilities are at Madison and Warrior. We have a contract detox unit at Walker Baptist in Jasper. And then we have multiple outpatient facilities or locations throughout the state. We can also do the outpatient virtually for Alabama, Mississippi, Georgia, and Tennessee. We also have sober living for men and women, so we have the full gamut of substance use disorder treatment. So
Bradford's very successful with that as well, aren't they?
I think, we have a real great setup.
That's good.
They are a professional organization.
They are, and contribute back to the community a lot. You do a lot of trainings and help JSU
Yes.
put on trainings.
We do. We will see you Thursday for one of those.
Yes, I'll be doing one of those for you guys. And you were supportive of the Out of the Shadows Summit, I think.
Yeah, we try to be very active in all of the community events. This is our home. This is where we're at. And so being a part of the community and giving back is really big.
Well, and you have some history with some of what Bradford does. Would you want to share some of that?
Well, September is National Recovery Month, and I am a person in recovery. So this is not only, it's my profession, but it's also personal for me. So I didn't get sober at Bradford. I'm from Mississippi, but I call Calhoun County my home now. I'm happy to be here. I've enjoyed it a lot. But recovery is a huge part of my life. I'm very blessed that I get to get paid to do this for a living, but it's also, it's my living amends, getting to help other people find recovery like I did.
So what does it mean when it says you're a territorial or territory manager? How big is your territory?
My territory is East Central Alabama, so I cover Etowah, Cherokee, Calhoun, St. Clair, Cleburne, Talladega, Clay, Randolph, and East Jefferson counties.
Oh my goodness. And what do you do exactly?
I do the marketing.
Okay.
So I go out and develop relationships and be part of the community and, see where's the need, where can we help, how can we help you serve the people that you work with.
Well, that's what the sheriff's office does.
Yeah.
They interact with the community. And so you heard the sheriff talk about how they just got some Narcan in and that they're having
I think
a
that's
couple.
awesome. I'm so glad to hear that. We can't deny where we're at with the opioid crisis going on, and so the more training, the more education, the better off we are, I think.
Absolutely. And opioids is something that, try to say it correctly, a lot of times it starts out with an injury, a car wreck, you hurt your back, you have surgery, whatever reason, and the doctor prescribes it. And a lot of times I think people think, well, the doctor prescribed it, it's safe, because a doctor wouldn't give me anything that's not safe. And these drugs have to be managed, and a lot of times it just gets away from people. So when you talk about Narcan, people have said to me before, why are you saving these people? Why are you doing that? And everybody's precious, but at the same time, I don't think anybody says, hey, let me go out and become addicted to drugs and ruin my life. It happens. And a lot of times, I don't know your personal story, but a lot of times people try and try again and try numerous times, but sometimes it works.
Right.
Treatment does work, and it's baby steps a lot of times, but it's something that I feel that we need to do what we can to save lives, and you never know who you might save, what they might do good in the world. So.
Well, like you said, nobody wakes up or as a child says, I'm going to grow up and be a drug addict. That's never anyone's intention. And especially with opiates, it often starts as a legitimate prescription, doctor supervised, and then it just becomes a monster that you have to keep feeding. And addiction doesn't discriminate. It doesn't care if you're the sheriff's child. It doesn't
does
care
not.
if your parents, the president. You know, if your family or they do mission work. I mean, it doesn't matter. It happens to all of us, and it touches everybody's families, unfortunately, in this day and time. And so I think that everyone deserves a chance.
Everybody's at risk, and isn't it wonderful that we have organizations like Bradford
Absolutely.
that can help people when they decide they need a change, and organizations like the Sheriff's Office, Compassionate Law Enforcement, that have the tools necessary to save a life, to maybe, promote that change. We're going to take a break, and we'll be back in just a few minutes with the second half of our lineup here on Calhoun County's Most Wanted. And welcome to the second half of our lineup. First up this half, Whitney Thomas. Miss Thomas, last known to be living in Oxford. She's wanted for failure to appear on possession of a controlled substance. And this is Chiquita Roundtree. Miss Roundtree, last known to be living in Anniston. She's wanted on a writ of arrest for trafficking in stolen identities. And have a look at Logan Bonds. Mr. Bonds, last known to be living in Rome, Georgia. He's wanted on a probation violation of robbery second. Meet Jody Johnston. Miss Johnston, last known to be living in Delta, Alabama. She's wanted for failure to appear on possession of a controlled substance. And this is Mario Galaviz. Mr. Galaviz, last known to be living in Anniston. He's wanted for failure to appear on domestic violence second, strangulation, domestic violence third, harassment. And this is Sebastian Ledoux. Mr. Ledoux, last known to be living in Piedmont, wanted for failure to appear on illegal possession of prescription drugs. And that's it for our lineup this week. If you have any information on these folks, please give the Sheriff's Office a call, 256-236-6600. Welcome back. We hope you saw somebody in that half of the lineup that you know where they are. And if you do, call the Sheriff's Office, 256-236-6600. You call the Sheriff Halls.
That's right.
We're here with Marbi McCann, Territory Manager for Bradford. Is it Bradford Health Services?
It is.
Bradford Health Services. They have an office in Oxford.
We don't have a office in Oxford any longer.
No longer.
Unfortunately.
But you sure are present. We wouldn't know that because you're everywhere in Oxford.
Well, I try.
And your territory covers half of the state and most of the unincorporated parts of the country, apparently.
So what's a typical is there different type programs for different drugs or alcohol? I mean, how does it work? What does Bradford offer?
Well, we have so many, great programs. What a lot of people don't know about, it starts with detox. Detox is to treat physical withdrawal symptoms for alcohol, opiates, benzos. So that's where your typical stay starts, is with detox. And then, we have the medical professionals. We have a chronic pain program. We have the veterans program at Madison. I think that all the services that we offer are great because we can give that specialized care. Because, not everyone is comfortable in the same setting or situation. And so, but yes, those three, alcohol, opiates, benzos, you would start with detox. The less physically addictive drugs like meth, marijuana, you can typically start on the inpatient treatment side of it.
So the detox is really, really important because if you detox from that stuff on your own, in your home by yourself, it can be very dangerous.
There can be lethal withdrawal symptoms.
Yeah, so it's good to have them go to the hospital first. Do you in your program, are you getting, obviously they're volunteering to go into your program, but are you getting people that are at emergency admit for detox? How does that work?
We do receive a lot of hospital referrals because that's where your typical person in need is going to show up, is at a hospital.
Okay, so they make a choice and they go maybe from the emergency room to one of your inpatient detox facilities. And how long would they be in the detox before they're ready?
Detox is typically about a 5-day stay. And then from that, if they're willing to do the inpatient programs, it's usually a 21 to 28-day stay. We also have extended care programs as well as, I think I mentioned earlier, we have a men's sober living program and a women's, which are more of your long-term. And then we also have the outpatient, which, since we don't have an office here in Oxford, we can do that virtually for people in this area.
Okay, so outpatient virtually. So for somebody that's having to go through that medical supervised detox, from the time they enter detox, 5 days detoxing, and then going into your various programs, what would be the time frame that they're looking at before they can say, you know, I'm home, I'm clean, I'm sober, and I'm back to where I need to be? How long would that process be?
Well, we're going to always suggest the longer treatment that you're able to do, the better your chances are of success. But your typical stay, about a month to a month and a half, would probably be your typical stay.
And do you track your recidivism rates and stuff like that? Do you know those?
I don't know the answer to that question.
Yeah, that's okay. So the longer the better. So if they can
For
stay,
sure.
and how long could somebody stay if they just wanted to continue?
Well, I mean, you can make, between all of the different programs and services we offer, you can make a year or longer
Okay.
out of it, if that's something that you're able.
Do you have many people doing that? Staying for a year?
Well, like I said, that would be between, you know, the inpatient and then doing the sober living. I don't really know exactly what the percentage of people that do that are, but as someone in recovery, and you know, not everyone has to get sober the same way I did, for sure. For me, though, that was successful.
Yeah. So, Sheriff, you arrest people, and sometimes they're high and they're on. They're
A lot of
poisoned.
times.
And how do they detox in jail? They end up going to jail for that.
They
detox.
do, and we have a policy. A lot of times, an agency will bring somebody to us, and they'll be clearly in distress. Just because you're a drug addict doesn't mean that it's healthy for you. So, a lot of times here lately, we've had people come. We had one last night that was arrested that we were concerned about excited delirium, which is a whole other topic. And we always make that law enforcement officer take them to the hospital for medical care for the immediate term to make sure that person is okay. And then, of course, we have nurses on staff 24 hours a day, 7 days a week, and they do a really good job. You know, people in jail, you know, they always want to say that there's not good medical care, but they have great medical care in our facility. A nurse is there, and if they need to see a nurse, they get seen the same day. And, you know, it's really hard to get a doctor's appointment and be seen the same day unless you go to a doc in a box, and they would wait longer at a doc in a box than they do for us. So.
And so people that are in jail and they're obviously addicted, but they're not using while they're sitting in jail, is there a method to get them from jail into treatment programs, maybe even Bradford?
You know, and that's more of a court process. I don't have the ability to let people go. That's not the role of the sheriff. You know, the judicial branch of government, I'm in the executive branch, so the judicial branch determines where these people go and the opportunities they get. But I do believe in forced treatment. I'm not sure what Marbi feels about that, but I feel a lot of times you got to have something hanging over your head to go, I got to do this. You know, and it may work and it may not. But, you know, if you get a year out of somebody that's sober and they fall off the wagon, if you can get them back on the wagon, maybe next time they'll go 2 years. So it's a struggle, but she's done it. People can do it. I've seen people that do it. It's not easy. I'm addicted to Diet Cokes. I try to quit diet, and it's not the same, but it is. You know, I could only imagine something as powerful as opiates or cocaine or something, but I can't quit Diet Cokes. When I don't have one, I'm anxious. I want one. So I kind of equate that to if I can't quit Diet Cokes, how hard would it be to quit something like opiates? It's got to be very difficult. So, you know, everybody wants grace and mercy, but few people want to give it. We got to remind ourselves that we need to give grace and mercy to people that are struggling, because when you struggle, you want it as well. So.
Grace and mercy, and that's a great note to take our break at this point. So thank you, Marbi, for being on the show.
Thank you for having me.
Bradford Health Services, they're in the phone book. They're available for detox and long-term care. And we're going to have our Crime Stoppers portion of the show and then our Crazy Criminals. So stay with us here on Calhoun County's Most Wanted. Welcome to the Crime Stoppers portion of our show, where we ask you to put your deer stalkers on and help our investigators with the following cases. First up, between September 10th and September 13th, a residence located on New Liberty Road in Jacksonville was burglarized. Numerous items were stolen, including rods and reels, 3 tackle boxes, a steel weed eater, throwing tomahawks and throwing knives, and much, much more. And on September 8th, a report was filed on a .32 caliber Ruger that was stolen from a vehicle located at Big Oak Drive in Anniston. And on September 17th, a 5x8 trailer with a yellow Hustler Razor zero-turn lawnmower, that's a Razor zero-turn lawnmower, were stolen from a location on New Liberty Road in Piedmont. And that's your caseload this week. If you have any information on these cases, please give the Sheriff's Office a call. That number 256-236-6600.
Stupid! You're so stupid!
Sometimes you feel like a nut, sometimes you're just a crazy criminal.
That's right. Tell you, Keith and Kelsey.
Keith and Kelsey?
Keith and Kelsey.
Yep.
They were in Hanover, Pennsylvania, and they locked their keys in the car while they were visiting the TJ Maxx.
Oh, well, that's okay.
Yeah. So you can read the title there. They were found with drugs and $135,000 cash. So if you lock your keys in the car
Yeah.
and you got $135,000 and a bunch of drugs in the car, you might not want to call law enforcement. But it gets better. Another reason why they were found, as the car was running and as the law enforcement officer opened the car door, when he opened the door, he could see the drugs, but the car was running and in drive, and it started rolling off at that point.
Oh,
so he had
lovely.
to jump in and stop it and put it in park. And there was $135,000. They were arrested for money laundering and also put in jail for drugs. I'm not sure what they bought, but there you go.
All right, and thank you so much, and that's it for our show this week. We appreciate you tuning in, and we hope to see you again next week, but not in the lineup here on Calhoun County's Most Wanted.